Hello and welcome to another new episode here on the Fact Factory podcast, the podcast where we dive deep into the truth and trend shaping our world today. You are with me, Ishmael Chimaza. So in today's episode, we are joined by a health expert who is going to give us insight about the annal fistula. So can you introduce yourself?
Okay, my name is Faith Fry.
So, what can you say about annal fistula, or what annal fistula is?
An annal fistula is an abnormal swelling that develops from inside your anus. The skin outside, it usually develops in the upper part of your anus, where your glands are. When these glands become infected, drainage from the infection can create a fistula. This infection is called a perianal abscess. Sometimes an annal fistula is also called a perianal fistula. Perianal means in the region of your anus.
So how common is this condition?
A fistula is relatively common on rectal condition. Is twice as common in men and people assigned male at birth. About half of people who get an infected anal gland will develop a fistula. An infected gland that forms an abscess, a pocket of pus that needs to drain, causes 75% of anal fistula.
So what are the signs and symptoms of annal fistula?
Okay, there's many symptoms of annal fistula. Firstly, anal pain, often intense and throbbing. You may feel more when you pop, cough, or sit. Your butt may be sensitive to touch, and swelling and redness inside or around your anus. These are signs of active infection under the skin. Fluid drainage from somewhere around your anus. It may include pus, pop, or blood. It may have a smell. And less common symptoms include fever, pain when you pee, difficult holding your pop in. You may or may not be able to see the fistula with a mirror.
So how can you describe the physical appearance of annal fistula?
An annal fistula looks like a hole in the skin near your anus. The hole is actually outmost portion of the channel, which connects to the abscess inside. It might ooze drainage like pus, blood, or pop, especially when you touch the skin around it. Some other fistulas may close at the opening, while the rest of the channel remains. This causes pain and swelling until the fistula reopens to let out the drainage.
So what causes the annal fistula?
Fistula can occur throughout your body, either between different organs or from an organ to an opening in your skin. They usually occur when your tissues are inflamed for a long time due to an injury or disease. Chronic inflammation and infection can eventually erode into the nearby tissues, especially when pus needs to drain. This can create a channel between the wound and nearby tissues.
So can you tell us the risky factors of getting annal fistula?
The most common causes of an annal fistula is a perianal abscess, which usually forms over an infected anal gland. An abscess is a pocket of pus that develops at the site of an infection. The pus needs to drain away and may create its own drainage channel to the outside. Sometimes a healthcare provider creates a drainage channel to treat the abscess, but often the wound doesn't heal completely, leaving a fistula. And common causes of annal fistula include inflammatory bowel diseases such as Crohn's disease, anal eyes, tuberculosis infecting your anus, a traumatic injury or previous surgery in your anus, radiation thereby for cancer in your pelvic region, actionomycosis, a rare bacterial infection that causes abscess, sometimes in your perianal region, hydrotic suppurative, a chronic inflammatory skin disease that produces abscess in your sweat glands, occasionally in your perianal region.
So, can you tell us the possible complication of anal fistula?
Okay, you are more likely to get an anal fistula if you were assigned male at birth, have had a perianal abscess in the past, have an inflammatory bowel diseases such as Crohn's, have a history of surgery or radiation thereby in your perianal region, are immunocompromised or prone to more frequent infections, have a chronic STIs. That's all.
So, can you tell us how the anal fistula recognized?
Okay, a fistula that goes untreated generally won't heal on its own. This can lead to long-term complications such as persistent infection. A fistula that stems from an abscess or infection may keep the infection active. The infection may seem to go away at the original site but then return, forming a new abscess and causing renewed pain. Sometimes the fistula may seem to be healing and may close at the opening, but reoccurring infection and drainage later open it again in repeating cycle.
So, do you have any other test for anal fistula?
Your healthcare provider might need to take imaging tests to see the path of your fistula. This might mean MRI. In MRI is a non-invasive imaging test that provides high detail. This can help providers map the path of the tunnel and also see how it interacts with your muscles and other organs. Endoscopic ultrasound as an alternative to MRI that produces similar images. An endoscopic ultrasound goes inside your anus with a tiny lightened camera and a tiny ultrasound probe. Fistulagram. A fistulagram is an X-ray of your fistula that your healthcare provider takes after injecting dye into it. The dye will highlight the path of the fistula. Your provider needs to know the pathway of your fistula in order to determine how to treat it. They will classify your fistula by its pathway. Yeah, that's all.
Okay, so can you tell us about the different types of annal fistula?
Okay, healthcare providers classify annal fistula by where they are located in relation to your annal sphincter muscles. These are the muscles that control your bowel move. It's important to protect them. Your provider might refer to your annal fistula by a specific name based on its location, such as interfectoric annal fistula. Passes through your internal annal sphincter muscle and then burrows out through the space between your internal and external sphincter muscles. Transfectoric fistula travels through both layers of your annal sphincter muscles. Suprasphincteric fistula passes through your internal sphincter and then goes around your external sphincter. Extrasphincteric fistula goes around both sphincter muscles. This less common type usually originates from your rectum rather than your anus, so it doesn't come from an anal gland.
Okay, so what's the treatment for annal fistula?
Most annal fistula will require surgery to fix. Spontaneous healing is usually requiring infections and abscess that reopen the fistula. However, if your fistula is caused by inflammatory bowel disease and isn't infected, it will occasionally heal with medical treatment. Your provider might try treatment with an immunomodulator, like infliximab, before resorting to surgery for these fistulas. Surgery. An annal fistula surgery can be simple or complex, depending on how simple or complex fistula is. The most common annal fistula are simple interfectoric fistulas, which only involve a small amount of muscle. These are safe to treat in a single operation. More complex fistulas may need surgery in stages. If your annal fistula involves only a minor amount of muscle and doesn't have any branches, it's considered a simple fistula. The surgical treatment for a simple fistula is called a fistulotomy. This one and done procedure is the easiest and most effective way to treat an annal fistula. Second one, fistulotomy. Your collateral surgery will out through the roof of the fistula, allowing it to fill in from the bottom up. They might also remove infected tissue, cutting through the roof, maybe cutting through a small amount of muscle, but a little is okay. Cutting too much muscle risks damaging your bowel control. Third one is complex fistula. Your fistula is considered complex if it involves a significant amount of muscle, if it has branches, or if you have pre-existing conditions that raise your risk of complications from surgery. Complex fistula may require multiple surgeries to fix your correction